Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. And today you're going to learn about health issues that affect the LGBTQ community. Our guest today is Dr. David Rosenthal, the founding medical director of the Care for Transgender Care and the medical director for the Center for Young Adults, Adolescents and Pediatric HIV at Northwell Health. He is also an assistant professor at the Donald and Barbara Zucker School of Medicine at Hofstra, Northwell. Dr. Rosenthal, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. Welcome.
Thank you so much. It's great to be here with you. I really appreciate it.
Tell us about your career path and what made you want to specialize in the fields that you specialize in.
So it's really interesting, actually. So I'm an internist by training, and I was a kid that grew up in Kansas. And from there, I kind of made it into the New Jersey marketplace where I was kind of where I did internal medicine. About 1/8 of the patients I took care of there actually were living with HIV. And then I did a fellowship because of my interest in the immune system here at Northwell Health, where I did my fellowship in allergy immunology. And after, another 7 years after medical school, I decided that wasn't enough education. So I went back to get the PhD and study immune responses to viruses. And so I'm really focusing in immune responses to viruses and where the immune system meets viruses. So this has been a phenomenal year with COVID and everything that's going on with that, some changes with HIV, which we'll talk about, and obviously monkeypox most recently. So that's really how I became the director for pediatric and adolescent HIV and created options for individuals who are trans and non-binary living here on Long Island.
So for those that don't know, the LGBTQ stands for lesbian, gay, bisexual, transsexual, and queer. Now, I know we had some additional things added on to that acronym, and that's IAPK.
Exactly. So I'm going to go back and see. So the T is usually, we're saying transgender rather than transsexual, because really what we're going to talk about as we kind of get into this conversation is people that are trans identify as being trans based on their gender identity, based on what's between their ears, the way they conceive of things. So it's really important that we talk about the transgender community. It's not necessarily about their sexual organs or being transsexual. So we also talk about lesbian, gay, bisexual, transgender, queer, people that are questioning, people that are also intersex, and people also that are allies of the community. And so it really is something that it's important that we're able to really expand that acronym and make it as inclusive as possible to include as many people as possible.
So the pansexual is all genders that you may be sexually involved with or have a desire to have sex with. The pansexual. Exactly.
Some people don't consider gender or sexuality to necessarily be a binary concept where you're either one or the other. Mm-hmm. So instead of being bisexual, some people prefer to look at individuals that have multiple different presentations and really look at the entire spectrum of sexuality and identify as pansexual, correct?
So has the K been added onto this acronym? Do you call it an acronym, or what is the term for the LGBT?
It's really a mnemonic more than anything else. It's kind of a way to remember the thing. It's sort of like an acronym, I guess, but I think that's there. Some people have used K and some people have not. There's been some conversations with different people that are interested in different communities and things like that. So there's been some discussion, but I think that really the concept that we need to think about is that the queer community or the LGBTQIA plus community really is an umbrella. And it's really all those individuals that don't kind of identify as heteronormative, heterosexual, cisgender. And we'll be able to unpack some of those terms as we get into the rest of our conversation today.
Sure. So tell us about the Center for Transgender Care at Northwell Health.
Great. So in 2016, I really had a need because I was seeing patients at a local LGBT agency, PFY, Pride for Youth, which is located in Belmore, right around the corner from where you guys are actually. And one of the patients kept coming to me saying, where can I receive resources that are going to address the fact that I'm trans, and how can I basically get care without going to New York City? And there's really no resources at the time in Long Island or really in Queens. So people really had to travel into Manhattan. Kids and parents were taking days off of work and school to get care. And so I looked at the wealth of resources we had at Northwell Health and said, let's take those individuals who have expertise in different areas and then be able to kind of create a center using the professionals we already had. So I took board certified endocrinologists, and we took primary care providers, and we took people that were surgeons. We recruited a gender affirming surgeon to be able to do surgeries. We also had a patient that I saw early on that was I diagnosed with lung cancer. They were so afraid to see a doctor for so many years, despite the fact they smoked 2 packs of cigarettes a day, that they actually hadn't had a checkup. And when I first saw them, their lungs sounded terrible, and I was able to identify with an X-ray something that was lung cancer. But this person had recently developed breasts or a chest. And so it was really important that they were able to get chemotherapy and radiation therapy in a way that was respectful of their gender identity. So we brought together those resources as well. So now we have over 50 or 60 different physicians from different practice areas to really provide kind of a whole family of services to patients with a specialty that identify as transgender.
Okay, so tell us a little bit about any trending or information you can give us about monkeypox as it does affect the LGBTQ community.
Yeah, so it's actually really been interesting. Monkeypox is an orthopox. It's a virus that's been around for a long time, which is why we had the vaccines pretty much ready. It's very similar to smallpox. And the challenge is that it is spread by lesions that go from skin-to-skin contact primarily. It can also be spread possibly through respiratory contact, but most of the time it's basically through lesions that touch other people's skin or open lesions or against garments or clothing or bed sheets or things like that. So we're really not seeing a lot of transmission of monkeypox, for example, to healthcare providers. We're not seeing transmission for casual contacts by people that you're walking by. We're seeing it by people that are in close physical contact with other individuals. And it does seem to be disproportionately affecting the LGBT community. It kind of entered into that community, and those individuals tend to create a tighter knit society and structure that they tend to hang out. They tend to have parties together and things like that. And so we think that's why it's spreading within those communities specifically.
So tell us about the vaccine that's available.
So it's great. So there's a couple of vaccines that are available. The one that we're using is the Jeanine vaccine, which is a very effective vaccine. There's 2 ways to give it. The way that's FDA approved is with an injection kind of in your arm, like you get most shots. But the way that we're giving it now, actually in our program in many places, is we're able to give only 1/5 of the dose underneath the skin. It's more like a tuberculosis test or a TB test that you get sometimes, which is just basically a small, teeny tiny little needle that you put just underneath the skin on the forearm, and you're able to put a little bit in there, and it's just as effective at preventing monkeypox. It is important to remember that you need to get 2 doses of the monkeypox vaccine, and those need to be 28 days apart. And in addition, with the vaccine, it's important to realize that you need to wait at least 2 to 3 weeks after your second dose before you're fully protected against monkeypox. We found that the vaccine is very effective at decreasing the severity of symptoms, the transmission of virus. We're still learning about it because really the vaccine has only been widely distributed now for about 8 to 10 weeks at this point.
So who should get it?
So the primary group that should be getting it is people that have direct physical contact with other individuals at high-risk populations. So that includes the LGBT community, especially people that are going to bars or to parties or to clubs or things like that. People that are for example, having skin-to-skin contact or have close physical association, live with perhaps individuals of the LGBT community, and also individuals that are significantly immunosuppressed may benefit from it. It is a live vaccine. It's a live attenuated vaccine, much like measles, mumps, and rubella is, in the same sort of way. And so it's important that we make sure we take a look and understand, the people that are getting it and understand how we can really make sure we're getting this vaccine to those people that need it.
So how does the monkeypox differ from any other transmittable illness?
So, it's not that different from a lot of other things. If you think about chickenpox, for example, which I think when you and I were kids, everyone kind of had chickenpox, right? We didn't really have vaccines, which we have right now. And I think that at that point, what we know is that, chickenpox really is spread through those open lesions that happen on your skin. And so basically, once those lesions crust over, then you're not really transmittable anymore. And so monkeypox is really spread in much the same way. It's basically these lesions or these little ulcers, these little pimples that are fluid filled. And when those fluid-filled ulcers open up, they release the virus in high concentrations in that liquid. It's those pustules or those fluid-filled locations that actually can most easily transmit the virus to other people. And that's typically through direct skin-to-skin contact or close physical proximity to someone. We think it may be transmitted through aerosols or through droplets in the air, but there hasn't been a lot of evidence that that's been happening in most locations.
And how is it treated, monkeypox?
So there's a couple of ways we do it. I mean, a lot like chickenpox, with chickenpox, you pretty much want to treat symptomatically. And there are antivirals that we can use. There's no specific FDA-approved antiviral that's available for treating monkeypox, but there is something that's available under EUA or under authorization for as part of a research clinical trial, and that's commonly called TPOXX. TPOXX is a antiviral that's able to basically decrease the duration of symptoms to make sure that you have less severe symptoms for less period of time and transmit less virus to other people. And so studies with TPOXX are ongoing. They're available through multiple different centers located in here in Nassau County and in your part of New York or other parts of the world if you're listening from other places. But I think that that's the only true treatment that's there. And the reality is that most people don't even need TPOXX. The majority of my patients, basically, we want to have them isolate from other people so they don't transmit the virus. We treat pain and discomfort from the lesions because the lesions can be very uncomfortable, especially if they're located on the oral mucosa, inside the mouth, the rectum, or on the penis, or in the vaginal area. So these are places where it's very uncomfortable. And so we want to make sure we're controlling pain and symptoms with that. And so that's the majority of the way that we're actually treating it at this time.
So is HIV and AIDS still a major concern? I don't hear talk of it like I have in the past, as I do hear of monkeypox. So talk to me about HIV, AIDS. Is that still a major concern as it comes to education and treatment?
Absolutely. So I spend the majority of my time actually taking care of individuals that are newly diagnosed with HIV or people that have HIV and that are living with HIV. HIV still is a significant concern. We still are seeing cases that are there. Thankfully, due to interventions like PrEP, which hopefully we'll have a chance to talk about soon.
Let's talk about that now.
Okay, great.
Yeah.
So let's jump about PrEP. So PrEP is as simple as one pill once a day or one shot every 2 weeks that prevents you from getting HIV. It's 98 to 99 to 100% effective at being able to prevent you from getting HIV. So think about that. That's one pill once a day. Or if you don't want to take pills, you go and see your doctor once for a shot, 1 month later, and then every 2 months after that for a shot. And through that, we can actually be extremely effective at preventing transmission of HIV. So it's important that we get this intervention into the communities that we really need to. We know during COVID, for example, that we were able to have disproportionate distribution of cases of COVID among the BIPOC communities of color, people that are brown, people that are Black, and other communities. And it's really important that we're able to prevent the transmission of HIV in those same populations because historically those populations have disproportionately been affected. So what we can do is we really need to take this great intervention and make sure that it's not just something that people are finding out from their doctors, or if they ask their doctors say, well, I don't know anything about that. But rather making sure people realize that they can get a free HIV test. They can ask for PrEP. They can contact us at prep@northwell.edu or give us a call at 516-622-5187. And we can basically make sure that we can get a team of people that can help put care around you and help you get on PrEP to really keep yourself safe and to make sure that you can take care of your own health.
So this drug PrEP, who is eligible for it? Who would you recommend have it?
PrEP is really available for anyone that has a risk of acquiring HIV. The way I talk about it is that if you are heterosexual and you have a history of gonorrhea or chlamydia that you've acquired recently, look, that doesn't come from the toilet seat. It comes from something that you're doing. And so the question is if that could happen, then HIV could happen also. And so what we need to do is we need to talk about using a preventative package. And that package includes condoms and it includes safe sex and it includes all these things. But PrEP is a tool in that toolbox as well. And so basically, if you're heterosexual and you're having sex with multiple different people, if you're a college student and you're not using barrier protection, those are people that it's really important that we consider PrEP for. If you're a member of the LGBT community, especially if you're a man who has sex with other men or with transgender women, it's important that you know that there's a higher risk of transmission of HIV through anal sex. And so we're able to get those individuals on a preventative modality. I think if you're having sex with multiple different partners, or if you're hooking up, if you're using apps like Grindr or Tinder to meet people, those are people that it's important that we're able to engage. And people that have also recently been hospitalized or that currently use injection drug use is also another population that's there. So the reality is that we really focus a lot, I think, in the literature and in the community about making sure that PrEP is available to young gay men. And that's certainly very important. But if we take a look from CDC data, there's actually the same number of heterosexual women that probably should be on PrEP as gay men. It's just a smaller percentage of the overall population of heterosexual women. So the way I look at it is that if you have sex with multiple different people, if you think you've had an STI, if you think you have risk, then this is a way that you can kind of help take care of your health care, take out additional insurance, protect yourself from getting HIV. And that's a really important modality. And that's why PrEP is such a great tool that's out there.
Yes, to that, how important, I'm saying from a health perspective, is it for someone who is LGBT to be out or to be open about their personal identity? How important is that?
Well, there's a couple of different things. I mean, I think the challenge that we run into for individuals that are part of the LGBT community is there's a huge amount of stigma that exists. That stigma exists within our own families. That stigma exists within our own communities. That stigma exists when we go to church or synagogue, we go to the places that we pray. That stigma exists in the shopping malls, and that stigma exists in the doctor's office. So I think what's important for us to realize is that we need to be able to be our authentic selves and to be able to come out in a way that's safe for us. What I always tell people is that it's important that you come out and you tell your story and you have your identity in a way that lets you be yourself, lets you be your authentic self. And I think that with a doctor or a provider, it's essential that you're able to come out because we need to make sure that they can take care of you for who you are. So if they don't know what's going on with you, if they don't know, for example, if you use substances or if you have anal sex, or if you haven't gotten a mammogram because we know that is a lower cases of individuals within people that are part of the lesbian community, then it's harder for that doctor to take good care of you, to know what specific needs you have. So just like if you have challenges with certain social determinants of health, if you have difficulty with getting food or difficulty with housing, or you identify as a member of the gay community, it's important that you share this information with your provider so they can provide the best care for you for being you.
So what is being done to improve the health for members of the LGBT community?
I think there's more and more knowledge that's available. And I think that as we talked about earlier in the conversation, the LGBT community is really a very large umbrella. And so I think that we need to realize that not one size fits all. And I think that the key is that by coming out to your doctor and telling your doctor about your sexual orientation and your gender identity, and we normalize that as part of the healthcare experience. I usually introduce myself to my patients and say, "Hi, I'm Dr. Rosenthal. I use he, him pronouns." By doing that, we're able to normalize the experience and we open the door for people to be able to come out to our doctors and be able to share their pronouns and their identities. So if you're trans, we want to make sure that we're addressing both your health, your physical health, and your transition health, along with your mental health. If you're a member of the gay community, we want to make sure that we're decreasing your risk of transmission of STIs and making sure that you're getting screenings as necessary for what you're doing in your sexual life. And if you're someone who identifies, for example, as a lesbian, we want to make sure that we are able to address risks that are controllable, like cigarette smoking and decreased incidence of mammography, decreased incidence of cervical cancer screening, to really make sure that we're keeping you healthy for you and for what's going on with you. And so I think opening up and talking to your doctor about these things really is the first step in making that happen.
So what about minors? How do you care for or treat or interview even, or, any history and physical when it comes down to a minor, someone who's under the age of 18?
So I think anyone who's basically over the age of 12 or 13, part of the visit with the pediatrician and the provider is to have the parents leave the room for part of that conversation. And I think that's a really important part of the conversation because we need to talk about all sorts of topics.
So this is over the age of 12, doctor?
Yeah, I think over the age of 12, over the age of 13, this is kind of really what we should be doing in a general sense, is making sure that the doctor can have a confidential conversation with the minor about a bunch of different topics. Do you feel safe at home? Do you make sure you're wearing your seatbelts in the car? Are you wearing a bike helmet? How are you taking care of your health? What are you doing for your sexual health? How are we taking care of things? Are there things that you feel that do you have enough food to eat? These are conversations that are really important that we can have with these young adults, that doctors need to be able to have these conversations confidentially and appropriately. And I often will open my conversations with patients kind of with a humorous conversation and say, okay, so right now we're going to talk, let's say I have a 15-year-old or a 17-year-old. I said, well, I want to talk about sex, drugs, and rock and roll. What kind of music do you like? And I think this is a really important way to open the conversation and say, kind of, what kind of music do you like? And then we kind of change the conversation and say, have you ever had an opportunity, or have you ever had a boyfriend or girlfriend, or ever kissed anyone? And you're able to move those questions along in an appropriate way, in a developmentally appropriate way, to figure out what needs that patient has for their own current development.
You're listening to Your Family's Health on the voice of Nassau Community College 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today you are learning about health issues that affect the LGBTQ community. Our guest today is Dr. David Rosenthal, the founding medical director of the Care for Transgender Care and the medical director for the Center for Young Adults, Adolescents and Pediatric HIV at Northwell Health. He is also an assistant professor at the Donald and Barbara Zucker School of Medicine at Hofstra Northwell. Hearing in the beginning of the interview, you talked about some surgical options that are for those who are, I guess, considering gender change or sexual change or sexual orientation change. Describe that for me and what you offer at Northwell.
Okay, great. So I think that there's different concepts. So sexual orientation is typically if you're gay or straight, heterosexual, bisexual, or pansexual. And your gender identity is how you identify, basically. Are you identifying basically as being masculine or feminine? And so we do at Northwell Health offer the range of different gender-affirming surgeries which are available. And I think that those are a possibility. But what's the most important for us to realize is that in addition to be able to having surgery, really coming out as yourself and having your gender identity, basically how you identify between your ears, and presenting that way, and having society and your family and your friends and your community respect you for that, is what's most important. Some people choose to start blockers or hormones. Some people choose to have surgeries. But what's most important is your gender identity isn't based on what organs you have. Your gender identity is based on how you present or how you identify.
And to that, what is a puberty blocker?
Great. So puberty blockers are medications that basically are able to hold off puberty for a period of time, typically up to 2 years, for individuals that are younger. They were developed initially in the 1970s for patients that were in the 7 to 8 age range to hold off puberty until they got older, like 9, 10, or 11, to start puberty, because starting puberty at that young age of 6 or 7 was very disconcerting. And we know that there's a lot of safety associated with puberty blockers. They don't cause long-term effects and abilities to have fertility or ability to grow. And so we know that there's a significant safety profile associated with them, since these medications have been used in children since the 1970s.
So what's involved in a young person that wants to have a puberty blocker?
So every case is different. And I think that this is an important part of trans health is that we don't necessarily say one size fits all. But when someone comes into our program, we're able to meet with one of our primary care providers, have an opportunity to be able to have a discussion, figure out where that person is developmentally, how long they've had the concepts, what their identity is, how strongly they feel about this, and how long this has kind of been going on. If someone saw a video yesterday and is identifying today as someone that's trans, that doesn't mean that it's not real, but it hasn't had a chance to be something that's been part of that person's life for very long. And so we really want to take into account all of these aspects. Typically, we'll also have the patient meet someone from our mental health team who's an expert in child and adolescent psychiatry with an expertise in gender. And then we'll also be able to eventually get some blood work and then have them evaluated by a pediatric endocrinologist if that's the path we continue down towards.
So if a child is interested in this kind of, I guess, would it be treatment or is it considered a medical regimen? How would you consider the puberty blocker?
So I think that the first thing that we do is the typical standard way we evaluate is people typically come out, they start identifying, they do something called social transition. They wear things like binders or packers. They'll have put on clothes that match the gender identity they're looking for. Some of the time they'll experiment with their hairstyles, and they'll kind of start socially using a name or gender markers or gender pronouns that identify with them. Typically, then they'll kind of consult with us, and we'll be able to then kind of help guide them in future steps and help figure out when the next step should happen, and realize that gender transition is a journey. It doesn't have necessarily a beginning, middle, and end, but it's really a lifelong process. And we want to help people go through that in an incremental, step-by-step way that's going to be appropriate with their identity and their personal development and their level of maturity as well.
So very briefly, what are some other diseases that seem to be more common among the members of the LGBTQ community?
So it's hard because there's not a lot of national studies that actually look at the LGBT community with regard to health disparities, unfortunately, like we look at race and ethnicity. But we do know that there's a high incidence of people that smoke tobacco, and therefore incidence of cancer, both of lung cancer, breast cancer, and ovarian cancer in people that are assigned female at birth. We also see an increased incidence of lung cancer and testicular cancer in individuals that are assigned male at birth. And so we do know that those things are significant risks. We see a higher risk of mental health issues within the LGBT community in general, and also some higher incidence of other sexually transmitted infections like gonorrhea, chlamydia, and syphilis. And so it's important that you make sure that you're able to get screened for those appropriately based on your healthcare needs.
So if someone wanted to get in touch with you for more information, what is your contact?
Great. So the best way to reach our programs, if you're interested in HIV care or PrEP for patients of any ages, HIV prevention, you can email us at prep@northwell.edu, PREP @northwell.edu, or you can, if you're interested in transgender healthcare or if you're non-binary, you can reach us at Center for Trans Care, Center for FOR Trans Care @northwell.edu. And those are the best ways to reach our team. You can also give us a call for Trans Care at 516-622-5195, or for our PrEP program at 516-622-5187.
So Dr. Rosenthal, what is the one thing, if you had to leave us with, when it comes down to the care of the LGBTQ community?
I think the most important thing is be honest with your doctor to let them know about your gender identity and your sexual orientation. Share that part of you with your provider so they can provide the right kind of healthcare with you. And if you're the parent, guardian, or adult that's important in the life of someone who's identifying as being part of the LGBTQIA community, we know that mental health issues and family support are absolutely the most important things to really maintain the positive experiences and the longevity of those individuals. And so be there, go along the ride, learn more, and be supportive of your young person as they go through their journey, and help support them in that process.
Thank you for being here, Dr. David Rosenthal, the founding medical director of the Center for Transgender Care and the medical director for the Center for Young Adults, Adolescent and Pediatric HIV at Northwell Health, and an assistant professor at the Donald and Barbara Zucker School of Medicine at Hofstra Northwell. We hope you stay safe and continue to stay healthy and continue to do the great work that you're doing.
Thank you so much. It's been a pleasure to be with you. Thanks for the invitation.
This is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College, and we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the nursing department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.